Welcome to the Cancer Institute of New Jersey's, also called CINJ, Gastrointestinal Surgical Patient Orientation Program. The objectives of this program are to give you a general overview into the surgical process for gastrointestinal or GI surgery and to prepare you and your family for your surgery. This includes before surgery, which is called preoperative, during surgery, or perioperative, and after surgery, also called postoperative. After viewing the program, we hope to have answered many of your questions. The specifics of your surgery will be discussed in detail by your surgeon. Please feel free to contact your healthcare team about any further questions you may have after viewing this program. During your first visit at CINJ, your surgeon will talk to you about your specific disease and offer you treatment options and his specific recommendations. During this visit, you will be informed if there is further testing that might be needed. Before your surgery, it is okay if you want to get a second opinion from another surgeon. It is important that you feel comfortable with your surgeon and the treatment plan that he or she is choosing for you. It is best to understand all of your options before committing to a treatment plan. Your surgeon might have other doctors in your care also decide if it is safe for you to have the surgery. These doctors may include your medical doctor, cardiologist, or pulmonologist. This evaluation aids the surgeon in determining if he or she should advise you to start or stop certain medications and/or order certain tests before or after your surgery. A letter of clearance will be written by these doctors if they feel your condition is okay for surgery. Your surgeon will ask you to return for a preoperative visit. During this visit, your surgeon will explain the type of surgery you will be having and the risks that might be associated. Your surgeon will ask you to return for a preoperative visit. During this visit, your surgeon will explain the type of surgery you will be having and the risks that might be associated with it. You will also be informed of how long the recovery period usually lasts, tubes or drains that you might have, and the type of incision that he or she will make. It is important to discuss the type of incision you might have. This may determine how long you will be in the hospital and the length of your recovery time. It will be during this visit that you will be given instructions for bowel preparation or cleaning of your bowels if that is needed. You will then be asked to sign a consent for surgery. Types of incisions. Here is a picture of a laparoscopic surgery. For this surgery, small incisions, about 1 inch, are made for the insertion of miniature telescopes into the body. Staples, sutures, steri-strips, or glue may be used to close the wound. The surgeon may choose to use an open incision, where a cut is made in order to get inside the body to operate. Staples, sutures, steri-strips, or glue called Dermabond may be used to close your wound. The actual method used to close a wound may not be determined until the day of surgery. Sutures or staples may be used instead of steri-strips or glue, depending upon the amount of tension in that particular area. Prior to going for surgery, you will need to go for pre-admission testing. The tests may include blood work, electrocardiograms, and a chest x-ray. This is usually completed 2 to 3 weeks prior to your surgery. Most surgeons prefer that testing is done at Robert Wood Johnson University Hospital, so all of the information is in their system. During pre-admission testing, you may meet the anesthesiologist or nurse anesthetist who will discuss the type of anesthesia you will receive and some of the medications that will be administered during your surgery. There are 3 different types of anesthesia. 1. General anesthesia, where a tube is inserted in your throat and you are then placed on a ventilator. A ventilator is a machine that breathes for you during your surgery. 2. Local anesthesia. Local anesthesia is a numbing medication given to the area where an incision will be made. 3. Local anesthesia with sedation. Local anesthesia with sedation is where numbing medication is given to the incision area, and you are also given IV medication that will make you drowsy and relaxed or even sleep. After your surgery, you may have pain. If you will be hospitalized overnight, you may be placed on a patient-controlled anesthesia or PCA pump for pain relief. This pump is usually filled with pain medication such as morphine and is given through your intravenous or IV. It is programmed just for you. If you experience pain, press the button and medicine will be delivered to you through a catheter. No matter how many times you press your button, you will be unable to get more than the programmed amount. The pump will keep track of how many times you press the button or request pain medicine. If you find that you continue to experience pain, ask your nurse to increase your settings or change to another form of pain medicine. If you are not placed on a PCA pump and are experiencing pain, ask your nurse for pain medication. If you are going home after your surgery, oftentimes you will be given a prescription for pain medicine. Another method of pain control is with an epidural catheter. This is placed in the epidural space, which is the outside part of your spine called the dura. Analgesics are injected through the catheter to help control your pain. Please note that this is different than spinal anesthesia. It is important to tell your nurse when you are having pain. Tell your nurse the ways that you have been relieved of pain in the past, such as a heating pad or an ice pack. If you are in pain, you may not want to get out of bed, cough, or deep breathe. This will place you at a higher risk for developing complications such as blood clots or pneumonia. Unfortunately, pain is very difficult to control once it is severe. Therefore, once you begin to experience discomfort, let your nurse know. Rate your pain using the 1 to 10 pain scale, where 0 is no pain and 10 is the worst pain possible. If you are at home, it is important to take your pain medication exactly how it is prescribed. Take your pain medicine 45 minutes before exercises or a planned activity such as a shower or a walk in the hallway. Pain medications will also cause constipation, so remember to take stool softeners as prescribed. Please refer to the constipation sheet included in your information packet. It is important to attempt to stop smoking before your surgery. Smoking can make it difficult for you to breathe on your own after surgery, requiring a longer time on the ventilator. It could also place you at a higher risk for pulmonary congestion, poor wound healing, or pneumonia. Substances like alcohol, blood thinners, vitamin E, anti-inflammatory medications, and aspirin can thin your blood, which can put you at a higher risk for bleeding during and after your surgery. It is best to stop taking all herbal supplements to help prevent any possible interaction with the medications you may be given during your surgery. Tylenol does not have the ability to thin your blood and therefore is safe to take prior to your surgery. If you are having general anesthesia, it is helpful to practice coughing and deep breathing exercises prior to your surgery to help your lungs expand and get rid of any mucus in your chest or throat. In your information packet is an instruction sheet that shows you how to do these exercises. It is sometimes necessary to clean out your bowels to help your surgeon see certain structures a little better. This is called a bowel preparation. Several different types of preparations are available, including Miralax powder, Go Lightly, citrate of magnesia, Fleet's phosphate soda, and Ducalax tablets. If this is required prior to your surgery, your healthcare team will give you specific instructions about bowel preparation during your preoperative visit. Please refer to your information packet for clear liquid diet instructions. Your bowel preparation might consist of taking 2 antibiotics the day before surgery. Commonly prescribed antibiotics are erythromycin, neomycin, or Flagyl. These medications will help in preventing infection. Your healthcare team will instruct you how to take your antibiotics. It is important not to drink fluids or eat food after midnight on the day of your surgery, so that your stomach is empty when you receive anesthesia. Speak with your healthcare team for specific instructions if you have diabetes. Make sure you take a good shower either the night before or in the morning of surgery so that your skin is clean. You will need to remove all nail polish before your surgery so that your nail beds can be used to assess the level of oxygen in your body. Be sure to remove dentures or false teeth prior to your surgery. This will make it easier for the anesthesiologist to insert the breathing tube in your mouth. Contact lenses need to be removed to prevent scratching of your cornea, and all jewelry should be removed, including your wedding band and any body piercings. Lastly, you should not wear makeup. Upon arrival to the surgical area, you will be asked to put on a gown with a surgical scrub cap. See the picture here. You will lay on a stretcher and the nurse or anesthesiologist will insert an intravenous line in your arm or hand for fluids and medications. The nurse or anesthesiologist will confirm all of your information prior to your surgery. You will then meet with your surgeon. When you are brought to the operating room, you will notice that it may feel very cold. Someone will then help you move from the stretcher to the operating room table. You will be placed on a monitor that will record your blood pressure, heart rate, and respiratory rate. A pulse oximeter will be placed on your finger to assess how much oxygen is in your body. You will be given oxygen through a cannula in your nose or a mask. The anesthesiologist will give you the anesthetic through your intravenous line. A surgical scrub is then performed on the surgery site to make sure the area is clean and free from bacteria. This picture shows the operating room and the table that you will lay on. Once the surgery is completed, you will be brought to the recovery room for further monitoring. You will be kept comfortable with heated blankets. Depending upon the type of anesthesia you receive, you may feel sleepy or drowsy. The recovery room nurse will continue to monitor your vital signs, including blood pressure, heart rate, oxygen level, and surgical dressing. If you are experiencing pain or nausea, inform your nurse so that she can give you medication to make you more comfortable. The surgeon may visit you in the recovery room to tell you how your operation went and will also speak to your family after the surgery. You may be in the recovery room for a few hours and then either discharged home or brought to a room in the hospital. Sequential compression boots, or TED stockings, help promote blood flow and prevent blood clots while lying in bed and not moving around as usual. After surgery, you may have these on you. During surgery, a Foley catheter may be inserted into your bladder to drain urine into a bag that is attached to your leg, as shown here in the picture. Depending on your surgery, the Foley catheter may be left in place during your recovery in the hospital. Some surgeries require a temporary suction device called a Jackson-Pratt or JP drain, which is placed in the incision during your surgery. This type of drain helps to keep excess blood and fluid from collecting in the wound. If you are going to be discharged from the hospital with this drain, your healthcare team will give you instructions regarding the care for the drain at home. A visiting nurse will come to your house when you are first discharged and teach you how to care for your drain. Check with your healthcare team regarding showering with your drain. Some surgeries may require a nasogastric tube to be inserted through your nose and into your stomach. This tube is used to drain air and stomach contents. It may also be used for feedings or giving medications. Your surgeon will discuss with you the need for a feeding tube. These devices are used to provide nutrition if you cannot swallow or if an extensive gastrointestinal surgery calls for sections of the bowel to be bypassed. If a feeding tube is required, your healthcare team will provide further information. As soon as your surgery is over, you will be given an incentive spirometer which will help expand and keep your lungs clear. Your nurse will teach you how to use it. It is important to use this and to continue doing coughing and deep breathing exercises to prevent pneumonia. It is also good to move around after surgery to break up any gas pockets that can cause you pain. Depending on what type of surgery you have had, you will receive handouts about specific exercises you need to do that will increase your range of motion. You may have already received this information prior to your surgery, and it will also be reinforced to you in the hospital by your nurse. If you are unsure, ask your healthcare team. You can visit the Cancer Institute of New Jersey's Resource and Learning Center for further information about these exercises. Unless instructed otherwise, remove the dressing 2 days after surgery. You may have steri-strips, sutures, staples, or glue covering your incision. Keep the wound clean and dry and wash with soap and water. Remember to wash your hands frequently, especially before and after dressing care, to prevent the spread of germs. Infection is a potential complication with any surgery. After surgery, it is important to monitor for signs and symptoms of infection. These include fevers 100.5 Fahrenheit or greater, wound opening, pus-like drainage or foul odor, increased redness, soreness, or swelling. You may experience one or all of these symptoms. If you have any of these symptoms, call 732-235-6777 and ask for the nurse helpline. Constipation is another potential side effect of surgery. It can occur from narcotic medications, immobility, and drinking less fluid. To prevent this, make sure you drink plenty of fluids, walk around frequently, and take stool softeners as prescribed. Please refer to the constipation information sheet included in your information packet. Some surgeries can create scar tissue or adhesions. A major long-term complication related to abdominal adhesions after gastrointestinal surgery is a small bowel obstruction. Immediately notify your surgeon if you experience severe abdominal pain or vomiting. Other complications of surgery may include scar tissue at the incision site. You may experience a sensitivity to the tape used to cover your incision, or you may develop a fluid collection around the incision site called a seroma or hematoma. Be sure to call your healthcare team if you have any of these problems. Be sure to call your surgeon's office immediately if you experience any of the following: shortness of breath or difficulty breathing, uncontrolled bright red bleeding from your surgical site, increased swelling of one or both of your legs with or without pain. If the surgeon's office is closed, you need to go to the nearest emergency room immediately. You should avoid lifting objects heavier than 5 to 10 pounds for the first 6 weeks after surgery. It takes a surgical wound that long to heal completely. We recommend no driving until you speak with your surgeon at your first postoperative visit. Before you leave the hospital, check with your nurse about arranging home care for any drains or dressing changes. During your first postoperative visit, Your surgeon will look at your surgical area, remove any sutures and/or drains, discuss your final pathology, and recommend further treatment options if indicated. It is important to check with your doctor first prior to resuming pre-surgery medications and diet to avoid potential problems. Start doing your range of motion exercises as soon as you are discharged home. Do not wait, even if you have drains or tubes in place. Please remember to review the papers in your information packet about instructions before your gastrointestinal surgery, deep breathing and coughing exercises, clear liquid diet, constipation, and nutritional guidelines for wound healing. A nutritionist who is a registered dietitian is available to assist you if you have questions about anything related to food, diet, or nutritional related side effects. If you feel you need to meet with the nutritionist, you can ask your surgeon or nurse practitioner. Your healthcare team may also suggest that you meet with the nutritionist. For more information, you can always use the Cancer Institute of New Jersey's Resource and Learning Center. You can find them on the web at www.cinj.org/RLC. You can call them at 732-235-9639, or you can email them at cinj-rlc@umdnj.edu. We hope that this program has provided you with a general overview of the gastrointestinal surgical process. Remember that your surgeon will discuss with you the specifics about your surgery. If you have any questions after viewing this program, be sure to write them down and ask your healthcare team during your next appointment. Please let us know what you thought about the program, which you have just viewed. Your feedback will help us make improvements. In your information packet is a document called Gastrointestinal Surgical Patient Orientation Program. Please complete this, bring it back with you upon your next visit, and give it to the nurse practitioner. Thank you for taking the time to view this program.